So welcome to this Path and TechNet webinar on scaling up a successful project on electronic immunization information in Vietnam. Today, I'm really happy to welcome the team behind this big milestone and Dr. Na, who's going to lead this presentation. Dr. Na is Path's country director for Vietnam. She leads a broad portfolio of projects that focus on immunization, infectious diseases, including HIV, tuberculosis, malaria, non-communicable diseases, disease surveillance, health system strengthening, and much more. So she's a very busy person. She's been leading this, the digital health initiative for supporting Vietnam Ministry of Health to develop national immunization information system for almost 10 years. Before I let Dr. Na start and introduce our other panelists, just a quick reminder of how you can participate to the conversation. You will see on the right hand there's a chat box where you can use and you can discuss with each other. You can also discuss with us if you want. There's also a Q&A box where you can ask your questions. Dr. Na will gather them and the team will answer them after the presentation. And if we don't have the time to answer all of your questions, you'll still have a chance to communicate with the team on the TechNet forum, or you could also communicate directly with Maya Rivera on the TechNet platform, or you can contact me as at moderator@technet-21.org, and I'd be happy to put you in touch with the team. Finally, this video is recorded, I just said before, and we'll share it with the presentation. Dr. Na, the floor is yours.
Thank you, Alex. Good afternoon, good morning. Hi, ladies and gentlemen. So on behalf of IDEO team, including PART National EPI in Vietnam, so we would like to give you some very brief information for our digital health initiative almost for 10 years. From a small scale advantage to nationwide application. So our initiative started with an Optimize project. This is a collaboration between PART WHO and National EPI in Vietnam since 2010. It wanted for both system immunization registry and also vaccine tracking system. And then we scale up nationwide in 2017 as a National Immunization Information System, and we call them that NIS. So today I would like to introduce our panelists co-present with me. From National EPI, we have Dr. Huyên, Vice Head of National EPI. However, she having some technical issues now, and I hope she can join us later for the interview and for Q&A section. And from PART side, besides myself, so we have Mr. Downing Sang, our program officer, and also Maya Rivera, our communication officer. So both Dr. Huyên from NEPI and Sang from PART have been working with me in this initiative from beginning 10 years ago. So in our presentation today, so we would like to give you some brief information about introduction, what is IDEO project in Vietnam, what we are doing now, and also some history background of NIS and scale up process, and especially some facilitator barrier, and we would like to share some lesson learned with you, and also next step. And second section will begin with interview with our colleague from National EPI and PART, and finally we open floor for Q&A. So I would like to give you some background on National Expanded Program on Immunization in Vietnam. So in Vietnam, our annual birth cohort about 1.5 million, and mostly vaccine given at the common health center is the lowest level of our health system. And on monthly basis, so we have like a 2 or 3 day immunization day per month. In some provinces now, they started immunization section quickly. And except for one exception for hepatitis B birth dose, we give birth within 24 hours every day as a hospital and clinic. Even our immunization coverage now pretty high now, but there's still a gap with the geographic inequality with lower coverage in mountainous and hard to reach area. So before 2017, and especially from the time of 2010 when I started this initiative, immunization information system were primarily a paper-based system. We have some computer-based system for reporting aggregate data, but it's mostly a paper-based system. So I would like also to give you some overview about EPI structure in Vietnam. So under Ministry of Health, we have a General Department of Preventive Medicine and also the National Expanded Program Organization we call NEPI at national level. So at regional level, we have 4 regions: North, South, Central, and Central Highland. And under each region, we have several 63 preventive medicine center. So and we also call provincial center for disease control now. And under the provincial level, we have a district health center at district level, and the lowest level is a commune health center. So we have about like 11,000 commune health center and more than 700 district health center and 63 provinces in Vietnam. And besides the EPI, we also have a vaccine provided at fee-based facility for both public and private outside of EPI vaccine. So as I just mentioned, that Project Optimize started working on this initiative from 2010 at this moment. And you see on the presentation, the picture we took at that time, it's really heavy workload of health worker with the paper-based system. And commune health center is primary point delivery vaccine for both children and pregnant women. So they use the paper-based system to register client, notify them, and make the list for the due date, and also record the information for vaccination. So with the paper-based system, so report also updated manually from immunization letter and take a lot of time. And this process is really time-consuming and prone to error. And it may lead to the issue with the data quality and also the vaccine availability also. So it's really a big issue with the paper-based system. So that's why we come up with the initiative that develops the information system to have national EPI to improve the immunization program. So you can see in the presentation that is a long history of development of our national immunization information system, NIF, for almost 10 years. So we started from 2009, 2010, 11. So at that time, under Optimize project, we have 3 separate systems. First one is we call backtrack. That system to check vaccine transaction and aggregating immunization report. And the second system is the immunization registry. And the last one is the immunization information system for fee-based facility. So at that time, for the backtrack, we pilot in only 3 provinces and in 1 province without a district level. For INREC, we pilot in only 1 district at that time. And then later on, we the government gave their resource to scale up backtrack nationwide, but at only provincial level. And then after that, Pat helped government to integrate backtrack and INREC into 1 system. And also we add the module for pregnant women and scale up the system to own a district in 1 province. And in 2015, we got a Health Innovation Award awarded by GSK and Save Children. And we continue to provide support to Ministry of Health, NEPI, and working with one of the biggest IT company in Vietnam, namely Viettel, to scale up those systems integrate into national immunization information system, and officially launched nationwide in 2017. So now we're helping government to transition from paper-based to paperless system. So you can see very clearly that for step of scale up from very small pilot at 1 digit only, and we integrated center and on and scale up. And now we form the technical working group to help government to continue the support for transition process. As you can see that the system function, we have two modules. One is the immunization registry, and other module is the vaccine tracking. So under immunization registry module, we have different functions that to register the client, whether at the community health center, evaluation facility, or hospital where the children was born. And we can have this system can automatically generate the ID, client ID. The health worker can use a barcode scanner to search, identify the client into the system. And also the system can help the health worker to do a lot for planning for immunization, and also create the list for due date, and also to generate the report and visualization on the dashboard. And also we can send the SMS reminder for immunization day automatically. So at this moment, we're also working very closely with Viettel, Ministry of Health and National EPI to develop the electronic immunization card to improve the accessibility and also the data quality and reduce the vaccine hesitancy. Because with electronic immunization card, the parent can also access to the system, search information and also correct information about immunization for their children and see the due date for the next vaccination. So now I would like to introduce Mr. Sang from Park Vietnam to continue to give you some overview about our IDEO project. Sang, please.
So thank you, Dr. Nga. So I would like to talk about this something in the IDEO project in collaboration with the Vietnam's National Expanded Program in Immunization. So we conducted the IDEO project funded by Bill Melinda Gates Foundation. So we call it the IDEO, stand for the Introducing the Digital Immunization Information System, Exchange and Learning from Vietnam. So you can see that in the screen. And project goals is to explore and disseminate the evidence and lessons learned from the Vietnam's implementation of the NIIS to support the successful implementation of the EIR in the other country. And we also aim to use this project to help MOH in Vietnam to improve the uptake and the effective use of the NIIS. Next, please. So in our project life, there are about more than 10 lessons learned or case studies when we collect and disseminate. So today is the time for giving us an opportunity to share the second lesson learned about the Vietnam electronic immunization registry from a district level pilot to a nationwide scale up. So in this case study, we use the global standard guidance to compare with the Vietnam's experience. The MAPS toolkit is developed by WHO. So following this document, we will share our experience through the phase from the groundwork, partnership, financial health, technology, architecture, operation, and M&E. Next, please. So for the groundwork and partnership are the first steps taken in a project to establish the essential components and determine the plan for scaling up. In Vietnam, the groundwork phase we did in 2009 at the Optimize project. And in this phase, we found both the facilitators and the barriers. For the facilitators, we did a landscape assessment before we designed the system. This is a very important work to understand the current situation of health information system, policy, the IT infrastructure at the own level. So what software in place or other development, we also explore the successful and the failure lesson learned from the existing software implementation. And the landscape assessment helps to determine the needs of end user manager at the levels and requirement for the system. We also explore the technical options and develop the business model framework, who are the key partner for the development and the deployment of the system, who are the champion in the implementation. And once more, the facilitator, we found out that government commitment are very important. So we should advocate and involve them from the beginning to get their support, including the leadership and the investment for the implementation. So you can see that on the slide, beside the facilitator, we have also some barrier are captured by our team, like the limited times for development and deployment, poor assessment, poor the infrastructure at the grassroots level, and limited the IT knowledge and skill of the health worker. So that is the very difficult to anticipate how long the end user can deal with the system. And we have another the barrier that we did not anticipate the growth of the targeted population. So how many the children would be registered and tracked in the system. So here the some lessons learned from the Vietnam for this phase for groundwork and the partnership to help the avoid potential mistakes or the challenge if you plan to implement a system like NIIS in Vietnam. So let's learn for the groundwork. So that the assessment, the landscape assessment during the groundwork that I mentioned before. That is the very important, provide the helpful snapshot of the current environment of the target population, helping to decide what is the best for the end user and prevent the duplication of the system. This in turn can help determine strategy, resource allocation, and the feasible architecture of the system. And also that the population grow and foresee the budget needed for the implementation. Demonstrating the success of the pilot help to engage the government commitment and provide the support, investing in the system. And also that we collect the evidence-based feedback from the end user. That is very important to make and correct system improvement. And also we need to develop the very detailed SOP for the standardized best practice for health worker at the grassroots level to increase the quality of data. So regarding the technology, so facilitator, you can see that on the slide. So facilitators enable the technology development for scale up. So MNO selection is based on the capacity and sustain the system in the long term. So Viettel is a state-run company. That is one of the biggest MNOs in Vietnam. And they also have a good relationship with the government. Sustainable technical leadership should be established in Vietnam. The Navy is taking the immunization technical lead with the support from PAT, and Viettel take lead to support the back end and ensure the system to operate smoothly. The successful of the NIIS in Vietnam is the system designed based on user-centered approach. So we collect feedback from the end user frequently for improvement. And Viettel for the NIIS in Vietnam, Viettel they provide the service rather than they selling the software as the countries the before. So that is like that to make sure that the NIS update and upgrade the on time based the requirement of the end user over time with the change of the policy or the change in the disease mortality and morbidity. So also that we think about the interoperability also that the to have to exchange the data from the NIS with the other system. However, there are the barrier in this phase, like a lack of the ID. So the ID is only to provided when the people they get the 80 years of age. So without standards, the unique the ID, the system, the tracking and monitoring the mobile population is very challenging, and that creates a duplication. And another the barrier that is the big data. We did not anticipate the big data, how big the data would be, and the system they worked well. Like at the beginning, after the 1 year implementation, the system is to work well with the 10 million of the children registered. But when the number increased to the 20 million, it is challenging. So now we have working with Vietnam to optimize the system, and we on the load balancing to support that the system run well. And for the technology lesson learned, so be prepared for and anticipate the data expansion, population prediction analysis before scaling up is the useful prediction tool. And MNO provides the service, not sell the software. So that we can maintain the support from the MNO. And also that the SOP that should be developed, and that's the very clear state protocol to ensure the data quality at the time of the data entry, and highlighting the importance of the avoiding the duplication, standardizing the duplication, avoid procedure, and provide frequent M&E activity. The EIS should be designed to interoperable with the other country information system, and the API that should be developed to communicate with the independent software system, integrate the data into the one national database. And regarding the operation and the monitoring and evaluation, so facilitators during the operation, monitoring and evaluation. So we think that the cascade training, we apply the cascade training for the big number of end users across the country. We set up the technical support network down to the district level, and also the set up the channel to share experience. So for the company health workers, they can join the social network, they can share the feedback, and also they share the experience on using the NIS. And we also develop the M&E framework at the early stage for this. So for the barrier in the operation and M&E, the time is for the training is very short. So it needs more time than we anticipated. And the sources of the funding for procurement of computer, barcode scanner, and for support this supervision. And SOP not developed at the beginning of the pilot. And when we implement this, so that the health worker at the level, they have to use the both system in parallel, both the NIS and paper-based system, so that create the workload for health workers. So for the lesson learned for the operation and the monitoring, the evaluation. So we should conduct the cascade training for the health workers, so that we can have new staff and facilitate with high staff turnover, so that we build the technical support network. They can provide the training for when the staff turnover, and also that do the fresh training, and also that the financial and human resource should be allocated for the local government to maintain the system. Yeah, for the M&E's lesson learned. So I think that we learned that they allocate the budget and resource for the M&E as early in the scale up as possible, and the adapting as needed. So develop an M&E framework from the pilots phase and based on to track the implementation of the system, evaluate the impact of the system on the health outcome, and also that we should create the monitoring tools and reporting the system to track the progress system implementation, as well as the comprehensive analysis to evaluate the effectiveness of the system. So I hand over to the Dr. Nga to talk about the paperwork and sustaining the system.
So I saw Dr. Nguyen already joined. Dr. Nguyen, could you please help to present this slide and the next slide if you can? Could you please help to unmute? Yes.
Here.
Or you need to speak closer with the microphone on your computer. Important one is a very important government commitment. We luckily we have very high commitment from many different level, from central level, also from provincial local government. So it's very important factor for the success. So this system was launched by Deputy Prime Minister and also Vice Minister of Health in 2017. So they very directly were involved in giving direction and guidance during development implementation. And also during implementation, we have a lot of commitment from different level, especially from provincial level, and investment from local provincial level authority. Also, because the central government they could not provide the budget for implementation. So mostly the budget for training come from local government. And the secondly, that we got very good and close collaboration between National EPI, Ministry of Health, and PART. From beginning 10 years ago, when we just start this initiative, and during every step, from a very early step of business analysis, system design, and also pilot at very small scale, demonstration, evaluation, and finally scale up and finalization. And in Vietnam, Ministry of Health partnering with the very big, one of the biggest IT service company, namely Viet Health, for national scale up for ensuring the sustainability of system. So they have very close relationship and collaboration and partnership between the system owner, National EPI, Ministry of Health, and the organization, international organization like a PART to provide technical assistance, and from IT service provider with Health. And we start with very small scale pilot, only one digit 10 years ago. So we learn from the experience. We got a lot of evidence to prove that it works, and also we get feedback from end user and manager improve system before we scaling up with the nationwide. So moving forward, that for ideal project that we still need to upgrade and improve the system. And meantime, we working very closely with NEPI to develop the implementation guideline and toolkit for transition process from paper-based to paperless system, and also to improve the data quality, data analysis, and use. And especially that for the big involvement from private sector of fee-based facility for immunization service. So it's very important that we also working with NEPI to increase uptake of the system from the private sector. So, and we also developing the e-learning portal just to help for training and refresh training as a very high turnover staff for immunization program. So it's very important that we can e-learning portal to help with that. And as we just mentioned, we also development of electronic immunization card, and we disseminate widely in the country. And we have several provinces as a pilot province for transition process. We capture our work documenting the lesson learned and share among the national and international stakeholders. So that's the end of our presentation. So I would like to introduce Maya to start interview with colleagues from NEPI, Dr. Nguyen and Sang from PARC. Maya, please.
Hi, so I'm the communications officer for the IDEAL project here in Vietnam. So I would like to interview some of the key people behind the IDEAL project. We'll start with the first question for Hien. If your microphone is working, can you just confirm that your microphone is working? Hien?
Hi, do you hear me?
Yes, yes.
Better.
All right. So so Dr. Huyen, in case it was missed in the beginning of the presentation, Dr. Huyen is the head of the NEPI office, so the head of the National Expanded Program for Immunization at the National Institute of Hygiene and Epidemiology in Vietnam. And Dr. Huyen, I'd just like to ask you to please describe how the NIS system helps health workers and also helps to improve the immunization program here in Vietnam.
Yeah. So as you know that we have more than 11,000 of the community health centers, more than 2,000 based facilities. So it means that we have only 13,000, more than 30. Reach them.
Dr. Hien, I'm afraid we're still having some trouble hearing you. So maybe it's best if we write out the response and share later with the participants, and then we move forward with the next interview question for Mr. Sang from PATH, if that's all right with you.
Yeah, sorry.
Okay, wonderful. Well, everyone's very interested to hear what you have to say, so let's try and write that out and send it to all the participants. Sang, I just have a question for you. Was there any resistance from health workers to use the system in the beginning, and how was this managed?
I think that is a very good question, and I think that for the resistance to is that happen when you the pilot or introduce a new system. So that is when we introduce the immunization registry in one district. So that is like so many health workers, they was resistant or reluctant to using the system, because that is the health worker at the grassroots level, especially that the older health worker, they have not used the computer before, so they was afraid of the learning the new things, the learning the computer use, how to use the computer and how to use the system. So that at that time, so many health workers they said that they did not like the system to use that, but we convince them that the system is like have many the function that can help their work, and we try to teach them how to use the computer, very basic the skill, like even that like typing the Vietnamese in the computer, how to move the mouse, that we very basic for them. And after 3 months, so they learn and they familiar with the computer use, and they start using the immunization registry. And after that, they found that the system is have the work, like in the how to track the children the vaccination history, and that they help them to create a list of children due for the vaccination. that work they worked on the paper-based system, they take a long time. Some they said that they take 1 week to list all the children they need for the vaccination. So that the lesson learned we learned from the pilot, and we apply for the scale up to the entire province. So we advocate the province preventive medicine center that they should involve the young people. They like familiar with the advanced technology, familiar with the computers or the smartphone, so that they can take the training, and also they support peer support. They provide the peer support for the EPI officer. So when they do the immunization registry at their facility.
And how do you envision the long-term sustainability of the system? Do you foresee that the system will connect to other HMIS in the future?
So I think that digital now, so the NIIS is very good. We scale up nationwide. So the health workers, they love it. Now we ask them that if we drop the system, drop or keep it. So on the health worker, they said that don't drop it. So that we think that the NIIS is the support that work a lot. So for the long term, when users they love the system, so the local government and the central government, they continue to provide the support for them, like they allocate the budget for the sustain the system. And also that the system now in Vietnam, we have a different health information system for the vertical programs. So that we think about that, the link, the data, and the exchange the information among the system, that can help the decision maker. They can see the data in the broad picture, so they can see and they can make the plan. So local and both the local government and the central government, they very supportive for that.
Right. Thank you. And finally, we will open it up for discussion and Q&A from our participants, and we'll take over to help moderate questions coming in. So please feel free to use the chat boxes on the side to type any questions.
Yeah, so we're happy to take the questions. Any question, please enter into the chat box and we will answer. Thanks.
So we have already a few questions from Niklas Danielson.
Oh, I can see the question, or I can see the question.
In the Q&A.
In the Q&A. Yeah.
So do you want me to read them for you in case you don't see them? I can read them for you if you want. Do you see them?
I see the Q&A section, but
Alex, you could go ahead and read, and we'll
go ahead. Okay, good. So the first question from Niklas Danielson is: can parents request certified printouts or certificates from the IIS database?
So what do you mean about the certificate?
Certificates, the vaccination certificate.
I mean the immunization card. Yeah, we cannot print out for immunization card because we have already pre-printed immunization card paper-based from national EPI, and also in the upcoming month we will use electronic immunization card. But the immunization card at this moment cannot print out directly from the system.
Okay.
I think that if I understand the correct, that you mean that they support the system, support to print now the vaccination certificate, right? So the system now the MOS we try to transit with the like a paperless system. So our team working with the MNO to develop electronic immunization card. So that the parents they can register and they can search. They can keep their children vaccination history in the immunization card for the life course. So I don't think that they just show the immunization card rather than to use the vaccine vaccination certificate.
Parent can receive the personal.
We really can't hear you. I'm afraid it's the sound is not good.
Hi, do you hear me?
Yeah, we can hear you very well now. Finally.
Okay, thank you very much. So almost the children they have the paper personal immunization book. So every healthcare worker when they provide one dose, they will write down the date, name of the vaccine, and loss of the vaccine. So they have a both. They can access both. The electronic immunization book is now available in the system, and also they have a paper recording. So in the case if they want to have a certificate for go abroad or something, they can have it. So my question is clear to you now? Hi?
Yeah, so I can see the next question about how do we store the EAI record on one of several servers in Vietnam or in how to do that.
So for this one, so Viettel now, so they are with the basic data and the provider they store all the records in cloud. So they support. And I see that the one question that the record and the social economic indicator for the children. How so? No. In this system, we just record only the personal data, some demographic, like a name, sex, date of birth, and the contact, the address, province, district, and commune, ethnic, city, and yeah, I think that is only just the personal information. So I see that the question about that the content. What is the content of the electronic immunization card for the pupil? So we developed it. We have now the development of the electronic immunization that they go to the lab phase. And so in the electronic immunization card for pupil, the way for the parent, they access to the system and they can see all the data of the vaccination history of their child. And also the immunization card also enable the interaction between the parents and the health provider, they can make appointment where and when which the facility they want to go for the vaccination, so that the health worker at the facility they can prepare and planning all the vaccine for that child. And under the immunization card, so we support the parents, they can see the date of the vaccination, what kind of the vaccination, and what did the vaccine can protect their child. So they can see very clearly about that. And if the health facilities, the health worker, they enter wrong date or wrong the vaccine, so the parents they can take a picture of the they can send feedback to the health provider that is wrong and they should change. So this can help to increase the data, the quality of the data. And from the immunization card, we add a function like the educate about the importance of the vaccination and about the adverse events, the potential, the adverse event by the vaccine. So the parents, they can read, they can know about the safety of the vaccine. So we hope that we can reduce reduce the vaccine hesitancy. Like in the Vietnam, so many the children they have adverse events. So that is the people, especially in the city, they anti the vaccine. They don't bring their child to the health facility for the vaccination. So for the in 2018 and the last 2019, so many cases, major cases, in Hanoi and the Ho Chi Minh cities, in big city. So that we hope that with the immunization card, we can reduce the vaccine hesitancy.
So I saw one question from Laos colleague that would like to see the tool for the e-learning. So actually, we not only the Vietnam country office, we also working regionally, working in Laos and Cambodia. So at this moment, we having one project, namely the sustaining Japanese encephalitis vaccination in Laos and Cambodia. So I believe that we already put the introduction of e-learning system for immunization program for Cambodia, but I'm not sure that in Laos that we will do that or not. But anyway, we're working with MCH Center in Laos, working with Dr. Tose and Dr. Panom, if you know them already. So if you want to see the tool, you can make a request through the Lao police. And we take the last question because we have only 4 minutes left about the issue with hard to reach earlier. That could be the network issue. Yeah.
Yeah. Okay, Saturday about the how to reach the health facility. So that we design a system that they can help the worker like for the high-risk area. So the facility they have to conduct the outreach vaccination. And the system also support for that because that is the outreach. In the outreach, the vaccination, the health workers, they cannot bring the computer, go to with them. And the electricity, also that is, and the internet connectivity is unstable there. So they can print out the list of children due for the vaccination. That is the very specific who need to what the vaccine and the what sort. So they bring the list of children due to the outreach vaccination. So they record and justify the child and the vaccine. They come back with the field list to the health facility and they enter data later.
So we take only one last question because I saw one question coming about the example of electronic vaccination record. So maybe we can send the screenshot. Maybe Maya, you can send screenshot. Maybe through I don't know how, through Alex or someone. Yeah. So we can see the screenshot for you to see how it look like. And interoperability.
I have a question. Is it possible to post the screenshots on the forum, perhaps, to share with everybody?
No, not now because we cannot show it now. Yeah, we need to take it off.
So the best thing, I guess, the best way to do it is for participants who would like to see the screenshots, please contact me at moderator@technet-21.org, and Maya will send me the screenshots, and I can send them to you. Yeah. And if you need to contact directly someone from the team, then I can put you in touch with them.
Thank you. So I don't think we have enough time to answer about interoperability. Maybe we can answer that question through email. Yeah.
Yeah, we have 2 or 3 other questions. It's up to you. We can speak another. I mean, 1 or 2 minutes more. It's not.
Okay, so we can talk about interoperability.
So that is regarding the interoperability. So now we develop the APIs. That is the application program interface to connect with the other system, like for the fee-based, the private, the fee-based facility. They use their own the system to record the vaccination data and the other kind of the data. So do we support via the API? Do we connect the NIIS with the system? And in the NIIS, we use the both brand name of the vaccine, the brand name, and antigen, the name. So that we that is the easy to analyze the data by the vaccine name or by the antigen. For the full immunization coverage, so we calculate it based on the antigen rather than to use the vaccine name.
Yes, so I think we take on question already.
Okay. So I think there were like 1 or 2 questions in the chat, but it's already past 2 o'clock here in Geneva. So thank you very much for this great presentation, and sorry about the small technical issues. Thank you, Dr. Na. Thank you, everybody, for this presentation. This video and the PowerPoint presentation will be available early next week on TechNet. If you'd like to have more information, as I said, you can use either the forum and reply to the announcement posted by Maya earlier, and you can ask further questions. And otherwise, you can also contact her directly by using her TechNet account. You can contact her directly by messaging her. You can also contact me at moderator@technet-21.org. And if you need me to put you in touch directly with the team. Thank you, everybody. Have a great day, evening, and hope to see you again soon for the next webinar. Thank you.
Thank you all. Bye-bye.
Bye. As Dr. Huyen, Vice Head of Vietnam's National Expanded Program on Immunization, had some technical issues during the webinar, Maya Rivera, Pat's Communications Officer in Vietnam, met her later and asked her some questions to complete the webinar.
So I have a couple of questions for you. The first question is, please describe how the NIIS system helps health workers and helps to improve the immunization program.
Yeah. So this is the first of all, at the beginning, the system is aimed to the immunization registration. That is to collect the core data for the personal immunization center. And so it had the health worker and immunization facility don't need to write down in the list paper into the system. The second thing that is that more and more big city and urbanization, so more private sector that involved in the immunization. It means that not only vaccine provided, the dose provided by the public services record in the system, but also the dose provided by private sector is need to be recorded in the system to identify what children they get the full immunization status or unimmunization or partial immunization, and identify the children who miss which dose they need to be vaccinated and need to move up or need to have to be vaccinated during the supplemented immunization activity. So the system to help to identify the personal immunization standard of 8 children, which antigen have been vaccinated with both public and private one. And the second thing, that's the help the facility to aggregate data from those, to aggregate the report from those data. And this to save time and save human resources for this, and they prevent the mistake caused by the staff during their practice.
Wonderful. Thank you.
Yeah.
So the second question I have for you is, how do you envision the long-term sustainability of the system? Do you foresee the system connecting to other HMIS in the future?
Mm-hmm. Yeah, it should be long-term if you want to implement an electronic immunization registration. It should be long-term, and at the beginning, it should be we have an approach of lifelong immunization history. It means that the dose provided anytime, anywhere in Vietnam can be recorded in the system. So, if you toward to an electronic immunization registration system, you need to think about a long-term system, and you need to sustain the system for many years. First of all, it ensures that every data have been provided in the system will be kept and can be accessed by any time and by any facility. That help to save the human resource. That is save the facility and help the parent to identify the dose the children missed or they have been vaccinated. And with the current situation and current approach, so electronic immunization registration is the trend of immunization system in the world. And other country is now toward that approach. And for sustain the system, it takes a lot of things to do that. First of all, on the technical side, and second thing is the financial aspect.
The financial aspect.
Yeah, you need to have an investment from central government to conduct this. But in some other country, they have a state system. They have their each state they have their own system.
Right.
So you need to have a different system to synchronize the data from all their state system. But in Vietnam, we have only one system for the nationwide. But for private sector, they own their own system to support them on financing management, vaccine management, and other. But we have a different way to develop API to synchronize data from their system to the state system, to nation, to the government system.
Wonderful. All right, and then I guess I just wanted to ask, is there anything else that you would like to say to our webinar participants about the system, or any additional comments from NEPI?
Yeah, that's toward an electronic reporting system. It means you should think about long term, and you have a roadmap. At the beginning, they have more challenges than our expectations. And you should think about that because you move forward to the electronic reporting system. Both the technical approach, you need to design the system that can cover for your long-term requirement.
Right.
And the second thing is the financial sustainable. So how to sustain the investment for the system. And the core thing is how to keep. You need to identify the IT service provider, because if you change system from this provider to other one, they can cause a lot of technical issues.
Right.
So last thing at the beginning phase, and for the introduction of electronic immunization registration system or electronic reporting system, it should be phased introduction. If your country is aware of that and ready for that, so it's fine. But if you are at the beginning or at the middle roadmap, so it should need your well planned for us.
Wonderful. Thank you so much for your time, again, Dr. Hien.
Okay.
Thank you so much. Bye-bye.
Yeah. Okay. Bye.